Good afternoon and welcome to this special presentation, Coronavirus Solutions for Buildings. I'm Troy Raszka, and I'm the Vice President of Marketing and Communications for Pure Air Control Services. I've been with the company about 4 years now, and this is certainly one of the most interesting experiences I can say that I've dealt with in the environmental solutions industry. With me today is our esteemed laboratory director. He is the Director of Environmental Diagnostics Laboratory at Pure Air Controls, and his name is Dr. Rajiv Sahay.
Hello and good afternoon to everyone. Today we are here in a scenario that can save a lot of things throughout the country and for that matter overseas as well. The coronavirus is not a strange name at this point. I guess everybody is aware of that name, coronavirus. So we are here to discuss something from the building side because there is a lot of information out there, or rather people are disseminating information regarding the clinical manifestation or clinical aspect of coronavirus. But today we are going to take the unique approach to give some information, disseminate some information about the building relation in terms of coronavirus.
Thank you, Dr. Sahay. So the agenda for today is we are going to discuss the background of the pandemic, the origins and background. We're going to do a brief recap of what is the coronavirus and COVID-19, how it's transmitted, and then we're going to get into control and prevention, environmental spread, environmental management in buildings, and then we'll talk about a few considerations and next steps that can be proactively taken to stay ahead of the game on this. And then, of course, we'll have a question and answer session immediately following this webinar. So we would ask that you hold all questions until the end and all material has been presented. If you could jot them down. Of course, we will provide our email addresses and contact information should you want to have a more in-depth conversation about it. So we're coming to you today from the Pure Air Controls Situation Room. We've been on top of this emerging pandemic, since about mid-January. We started doing our initial research, posted our first news articles, blog articles, and started ramping up to be able to address this virus inside the built environment. So I'm going to give a little background on the company right now, just to fill you guys in. We've been at this a very long time. We've been through H1N1, we've been through SARS and various other viral outbreaks. We were founded in 1984, and we have 3 specialized divisions that each deal with a different aspect of indoor air quality or indoor environmental quality. And those divisions are Building Sciences, who provides IAQ testing, test and balance work. They can do very forensic level investigations on buildings, or they can look at the entire envelope. Next, we have our Environmental Diagnostics Laboratory, of which Dr. Sahay is our director. They are a CDC elite program laboratory for Legionella testing, as well as being a New York State Department of Health EDLab certified for Legionella testing and heterotropic plate counts. And then finally, we have our Building Remediation Sciences division. And these are the guys that we deploy to go out and fix any of these issues that we find inside of buildings. So all told, since our founding, we have over 600 million plus square feet of experience in 10,000 plus buildings. And we focus on government agencies, city, county, state, federal agencies, defense, education, healthcare, and other commercial interests. So all of the people we employ in one facet or another with these different divisions we have are certified and or affiliated with the relevant groups that are industry standard for the type of work we're doing. And you can see those lined up across the bottom of the screen. Most typically, we're looking at ASHRAE, NADCA, And of course, we are a certified environmentally responsible contractor through CIRC. So we do keep our affiliations and certifications up: certified mold remediation, certified mold inspection, ventilation system, mold remediation certified. So we're doing things at a very high level environmentally inside buildings. And then finally, and we'll talk about this more at the end, we do have cooperative purchasing contracts available for our educational partners, for city, county, state governments. And we also have a GSA contract that is available, and we'll get into that near the end of the presentation. So Dr. Sahay, as we go to take a look at the background of the coronavirus, we would like to get your input on what this virus actually is and sort of the timeline of what's happened here.
Very good, Troy. I guess, as I said in my onset, that the people are not strange at the time to understand what is coronavirus. But let me tell you this: this is not like a very recent, thing for the human being. Human being is aware about the coronavirus as early as in 1960. And there were a couple of authors, I want to quote their name, Tyrrell and Bonnet, in 1965. When they have done some isolation of this virus, back then they called this virus as B814. That was the name, and the paper was published in the Lancet Journal in the volume 287, issue 7428, and appears on page number 76 to 77. That was out for researcher in 1966. That was the journal which I quoted. But having said that, this particular strain of the virus was not known until late 2019. So it is late 2019 when people find out some very non-systematic symptom for flu-like symptom, other infection, etc. Clinically speaking, in the city known as Wuhan in China, and perhaps after initial investigation, this particular virus is named as 2019-nCoV. That was the initial name of the virus, but to make sure that the associated disease go with that, term COVID was coined by everybody who is in this field and recognized by the World Health Organization. Now, after initial investigation, these two agencies are doing a lot of work behind the scene. One is the World Health Organization, another is our own CDC. They are doing a lot of work. So it has took some time with initial investigation, but finally the World Health Organization declared this COVID-19 as a pandemic on March 11, 2020. As we are sitting in the situation room, I'm pretty sure this clock is rapidly changing. But just to give you a glance, that at this time throughout the world, about over 200,000 people are infected with this particular COVID-19, and unfortunately over 8,000 are not among with us, meaning they passed. And the good news is that this is not like a disease that you are going to disease, but at the same time there is a lot of recovery. Over 80,000 people is recovered. So if we do due diligence, do the practice, and do the recommended stuff, then we are going to save ourselves from this virus. That makes sense, Troy?
It sure does make sense. And of course, the World Health Organization, these two links here, and the Centers for Disease Control and Prevention are probably the best, most reliable sources at this time to get late breaking and current information.
Exactly, and you should not be getting pillar to pole to get the information. Just hit this website. These are the public domain. You don't have to spend money. You don't have to do any more than you should be, or as a public you should be getting this information which is publicly available.
That's right, direct from the source. So now that we've covered the background of the pandemic and how we've gotten to the point we are at, can you explain a little bit about what coronavirus is?
Yes, really, if you want to understand anything, first you have to understand what actually it is. So basically, as the name itself indicates, it is a virus. Virus is sometime in the laboratory also, many times customer ask that whether it's a living thing or non-living thing. And unfortunately, this is one of the things which we have to say that it is living as well as it is non-living. So you should not be thinking that I'm telling that just because I don't know the answer, but the answer is true, that it sometimes behave as a living organism. while it is with the host, and it is also going to be non-living organism or non-living entities when it is on the laboratory bench. So it is a connecting link between the living and non-living thing. At the same time, I want to give a little bit more information on this because this is a very simple form of creature. It is submicroscopic in size, meaning that it is even smaller than a microscopic particle. What I mean to say that, like, if you take a regular microscope, perhaps you are not going to see these entities. You need to have a specialized microscope that is called as electron microscope in order to study that. So for the chemical makeup of this particular virus is concerned, they are made up of, like, protein and the nucleic acid, and they are spherical or neomorphic in shape, meaning they can change the shape, and it is envelope shape, like it is having in coil in an envelope. As you can see in the diagram, that in the diagram you see that in the center core is the coil kind of thing, is the RNA, that is the genetic material, and outer spike like a structure that is presenting it as a corona because it's a crown like, and the Latin treatment for the crown like stuff is known as corona. Perhaps the name is being driven from there. The other thing I want to tell here is that it is zoonotic. So zoonotic meaning that it transfer from animal to man or man to animal. That is zoonotic. That is the definition of zoonotic. We'll cover a little bit more about zoonotism in the next few slides. But at the same time, unfortunately, its source of COVID is remain unknown because there is no certainty. Some one school of thought is believing that it is coming from, like, some Chinese fish market or seafood market, but quite frankly, there is nothing on record that which I can share with you that from where this virus is actually originated. All we know at this point of time that it has started from a city called as Wuhan in China. It makes sense?
That does make sense. And then, of course, as we're looking at this, we can see that it has an envelope layer, which that's the layer that protects the RNA and basically constitutes how the cell is made up. Is that correct?
Yes, that's correct, because it's a protein and the nucleic acid, then the different kind of protein is there. So that will be, like, a matter of, like, some detail, like, information which is not meant for this seminar.
Yes, and we'll talk about the envelope structure of the virus in a little bit when we get into decontaminating for it. So next, I mean, we've seen a lot on the news. We've seen a lot of people sharing stuff on the internet, but let's go through this. How is it transmitted?
That's an excellent question, and I guess this is the slide where I want to take a little time to explain to our participant that you don't have to be panicked, because good news is that, first I want to tell you the good news, that it is not airborne, and I underscore, it is not airborne, and that is a big thing so far the transmission of virus is concerned.
And by that, you mean it's not just living in the air every place at all times, right?
Exactly. So how it is being transmitted, first I need to give some background information that this virus, as I was quoting, that this is known to human being from 1960 or so, this particular family or group of virus, not this particular strain. But at the same time, we need to understand that this is a zoonotic disease, if you would, the COVID, if you would understand in that way. So what happened, it exists in animal and it can be transmitted to the human. So far the animal is concerned, still we haven't mapped the entire group of animal where it can, but simply the previous, like, viruses like this, like a SARS or the Middle East respiratory syndrome, these viruses are also from that family, and that can be in the camel, that can be in the cat, that can be in bat, that can be in snake, that can be in duck. These are the known sources from where you can have this virus. At the same time, it is very important to understand, in order to preserve or in order to prevent the transmission, that how it transmits. So mostly this virus is transmitted from person to person, and especially if you are within 6 foot distance, if you are maintaining from a person who is already infected, then you are at a greater risk of getting or acquiring the infection, as it is illustrated in the diagram, that when you basically develop some aerosol or aerosolized material such as respiratory droplet during the coughing and sneezing, then you are millions and billions of inoculum is being come in form of like droplets. That's the right or correct terminology to use. And we have illustrated a droplet in the side diagram. As you can see that the droplets like size, like it is sort of like a pond where like all these fishes are like swimming, if you want to like understand in that way. That droplet is going to either inhale by you, meaning the healthy individual, or if it is set on the formite, meaning that some kind of surface like such as a hand or palm, and then if you touch your hand or palm, then it is going to be contracted as well. So the transmission basically happen by contacting the contaminated surface or objects, and hand to face, it is being transferred very easily. So if we can just take care of that, and if this information is given to everybody, then perhaps half of the problem is solved, because you know what is the region for the transmission. I guess that was one of the very interesting slide. That's why I have taken time to explain, so that you can understand the root of this problem, and from there we can build our like remedial action.
Well, thank you, Dr. Sahay. That does make perfect sense to me. And again, what we're talking about in buildings is one, person-to-person contact, and then if an infected person was in a building, having these aerosolized droplets either deposited on surfaces within the building or being taken up and into the HVAC or ventilation system. Now, I want to pause for 1 second to let everyone know, and many of you probably do, that on our website, PURE-Controls.com, we have a dedicated coronavirus page that links to resources for various scientific studies and papers. So we're not going to go too deeply into how this can and be distributed through the HVAC system from a scientific standpoint or a physics standpoint, but there are research papers on there that talks about how this gets into the HVAC system and can be distributed through it. So moving on, we do want to talk about control and prevention for buildings, but first let's talk about control and prevention in the clinical aspect or the person's aspect, human health.
That's very important actually, Troy, because first you need to understand that what kind of symptomology you can expect or what is happening, so that you can start like taking care of yourself and others. So in pursuit of that, you need to understand that how you can control it. So very basic point, and everybody and a lot of agencies are doing good work to promoting that you should increase your personal hygiene. When I say personal hygiene, what it means? Personal hygiene meaning not only like cleaning your like body or your place where you are living, but at the same time you need to be very mindful that what could be the potential source. For an example, in this context, like if avoid the close contact with the others who are already known infected, or others who are already declared that they have either inoculum, or they are under the incubation period, or they are showing the symptom. So what in nutshell, you need to avoid the contact for that. You should be also avoid to contact like the people from very close distance, no matter whether it is already established or it is not established, but it is always a good idea that you should be like talking to someone. You need not to be rude, but at the same time you should be making like the appropriate distance. You should be always like whenever you have a cough or sneeze, you should be always using a tissue or your armband to just like cough on that. Just do not start coughing like randomly on somebody's face or in the clothes when that is against like the thing anyway. So it is not like very socially accepted practice. But at this time we should be very, very careful. When you cough or sneeze, use a like tissue or any kind of other thing which you properly dispose. That's the main thing, because if you are using a tissue and if you have that tissue lying around the table or bed or something, you are basically causing more harm than otherwise. So you make sure that you dispose it properly. You wash your hand very frequently with the soap and water. That is a miracle. I guarantee you that if you start doing like soap and water, almost every microbe on your palm is going to go wash away. That is a known fact. We can use the sanitizer. Sanitizer is another thing, but sanitizer also works. You should also disinfect the object and surfaces very frequently. I'm pretty sure that everybody in every household basically have some kind of product by which they clean their surfaces such as Lysol or any other thing you can get from simple grocery store. And I believe that on an average family go in grocery store, they don't forget to buy their sanitizer like Clorox, bleach, this kind of product you need to have. And one very important thing which I want to tell you is that there should be barrier. If you have a barrier, like if you are using a mask, then you should not be just removing it. So there is no intervention in the barrier. If you are having yourself like avoiding contact and you are in the social distancing, meaning that you are just keep yourself in some quarantine practice, then make sure that you religiously practice it. It just doesn't say that, oh, I'm in the quarantine, and you start like talking to people, meeting the people, then that obviously that's not the meaning of the quarantine, and it's not going to work. And then I want to especially thinkful or thoughtful for the caregivers. The caregiver, it is very important that they should be stay healthy in order to take care of other people who need care. So in those scenarios, that the caregiver must be having the PPE, that is called as personal protective equipment, in which they have to have a N95 mask, they have to have toe to head to toe like gown, or is called as coat or apron, however you want to define it. Then you have to have full mask coverage, like you should not be exposed in area. You should have like hand gloves, you should have goggles. These are the things which is used as a personal protective equipment, and you should be practicing it. The one thing which I have to be definitely bringing it in the clinical manifestation is the anxiety and stress. Don't get like panic, because if there is a problem, there is a solution by managing it. So anxiety, and the stress is the another thing which make you sick even more speedier than otherwise. Make sense?
I do. I understand. We want to try to remain panic-free and logical in our thinking throughout all of this. So now that we've covered sort of the human health aspect, the clinical side, let's start talking about the real meat and potatoes of this presentation, and that is the environmental management and planning, and then what we can do about it within the built environment. So as you know, we're an indoor environmental company. We're very data focused. We're very scientifically focused. And so when we come into this, we're going to look at how this is transmitted across surfaces and then perhaps into the HVAC system. So with that being said,
yeah, that's the another thing which
we will be
practice,
talking about
that,
high touch surfaces, right,
yes,
Doc? We were looking at high touch surfaces
yes.
as being a way, or probably the most rapid way, to transfer it to your hands and then up to your nose and mouth.
Yes. So first we need to make sure that everybody understand that what is the high touch surfaces. High touch surfaces, as the name indicates itself, that in the your home and your office places, what is it? Such as nowadays, like everybody works on the computer. So the computer, board, like phone, keypads, then you have like your countertops, you have office stationaries. And don't forget that the currency note and the coins are the other two things which we are dealing each day with that. So those are the thing which can be the carrier of this virus. If the virus inoculum is going to settle on that, and if you touch those things, then it is going to transfer in your hand. And like try saying that, like if you touch your contaminated hand to your face, your eye, your nostril, then you are going to inherit this virus. Nobody is going to save that. One thing I want to tell you, that since this virus is very sensitive towards the temperature, so it tend to find a relatively colder place in your body. So what is the coldest place in your body? Is just like your nostril, like through your upper nose area is like a lot of mucosa there. That's why the coldest place. And then the virus try to hang out there for a while. So it is also being said that if you are taking care of that virus while it is in that place, then it is not going to pass in your lungs or go down the lungs and create the problem. So the other question which is nowadays is arise, and everybody is asking that, okay, so what is the viability on the surface? Because if it is transferring through the surface in the environmental side or from the environmental point of view, then what is longevity? Well, we have done a lot of research, and we have found a paper which is published by copied in the hospital infection journal. It was a very recent publication, and they are saying that it can live up to 9 days on the various kind of surfaces. Needless to say that either it is glass surfaces, plastic surfaces, or any other surfaces you can think. So they have said that it can live up to 9 days. It is just not to be like making you scared or panic, but it's just for the information purpose that you should not be taking this thing very easy or very lightly, because there are likelihood that out of sight, out of mind, because you are just working on a bench, you just like, have some good call or something come, you just disappear from that bench. But guess what? Behind you leave these kind of inoculum that can be there, and if some other person is going to come or touch those things, that they are going to inherit it. And the other thing which I want to insist here, that the temperature and relative humidity, this is the two very vital environmental parameter that is going to support or seize the development or growth of this particular virus. So that is one thing you need to focus.
Well,
So
yeah, that's true. The surface viability, which is going to impact how we decontaminate the building, what we look for in the building. Now, is it true this paper was published by German researchers
German
at a
group,
university and also a German hospital? And this paper took into account 22 different studies about SARS and MERS, which were both coronaviruses. So they compiled all of the surface viability and infectivity data between 22 different studies and then put it together in this paper. So they're saying under the right conditions, a biological food source, certain substrate, metal, wood, cardboard, plastic,
conditions
glass.
should be meeting, like the appropriate for that. This is called as favorable condition. But at the same time, we need to pay attention that, like, if you increase your building hygiene practices, that is going to anyway take care of your lot of problems. So be proactive, guys. We make sure that not only the personal hygiene, but the hygiene of the entire building is a very, very important facet, or very, very important part of the whole equation. Is like when you say like building hygiene, it doesn't mean that like you are going to use the Swiffer or something and just wipe your surfaces, or just suck like the all the debris by using a vacuum cleaner. But there is a lot of things that you don't see like each day, such as like your heating, air conditioning, ventilation system, that you have like big duct work going around, like a network of duct. You have like mechanically controlled ventilation nowadays in the modern building. That is another place where if anyhow if this virus get transferred in that, then can you understand the ramifications? Because in the duct, if they provide like the suitable condition for this virus, then the virus is going to propagate there. And of course, like we are saying that like we are saying that it's a 9-day is their period. They can be live up to 9 days. So even though if it is like in that period somehow or the other get transferred in those kind of situation, then it can create a lot of trouble. But the good news is that still human beings hasn't given up, because we have like a lot of disinfectant known. So use those disinfectant to like clean those building places which we are talking about, like such as doorknobs, like tabletop, furniture, all the high touch surfaces, etc. And there is a big list by the public agencies where you can find like they approve like the disinfectant, so you can use one of those for that purpose.
That's correct. And now, Doc, I mean, before we move on, when we talk about a couple slides back, we were showing that diagram of the aerosolized droplets being distributed out from a cough or sneeze. Well, these droplets are very small. They can get in between the keys on a keyboard, or like this phone that's pictured. I mean, so just wiping the surface of that might not be enough. Is that correct? I mean, the droplets are aerosolized and fly through the air and can deposit in
on the
many
hard to
different
reach,
places.
hard to reach surfaces, and like cracks and gaps in like various building and all, which is you're not readily going to like take it out. So then there are solutions for that, like we can use like other technique. That's why we have the technique to reach those surfaces to clean those appropriately.
Right, and so when we talk about increased building hygiene or housekeeping, we're talking about going above and beyond what's normally done in a custodial type of situation. Is that correct?
Yes.
I mean, we're looking at planning for a pandemic, a virus, or even certain kinds of bacteria like Legionella or mold in a very different way than you would plan for normal janitorial practices. And so as we approach this environmental management and control, right, we have to first consider how we plan for this and what kind of important data that you all need on hand to be able to begin working with a company like Pure Air Controls.
Because that's the important thing, because data doesn't lie. So what you have to do, like, you have to first of all assess, that is the planning part. You have to assess that how worst or how bad the situation is, so that you can like create a control measure, right? So for that you have to have some important data, and obviously in this particular scenario the data on temperature and relative humidity is one of the data which is a supportive data. Just controlling these two things alone can solve a lot of problem.
I agree with you. And then of course, as we said in the last slide, using disinfectants for emerging pathogens, EPA registered disinfectants for emerging pathogens. And if you go on the EPA site and search that, you can find an 11, 12-page list of all of the different types of disinfectants that you can use. Now, for those of you who have been with us since the beginning, maybe some have just joined, the coronavirus family of viruses is an enveloped virus, meaning that it has a very thin lipid envelope that encapsulates the RNA or the reproductive portion of the virus. And that's correct, right? These enveloped viruses are actually very susceptible to disinfectants. So once they're on a surface, using these approved disinfectants will be effective in using it. Of course, we offer at Pure Air Control Services a multi-leveled engineered approach that is a combination of different services that we're going to explain to you in a minute here that we use to offer 5 different levels of decontamination for your building. And they include our PURE-Decon service, and we can also include intensive topical cleaning and carpet cleaning in that. Of course, our Pure Steam HVAC and air handling unit cleaning, and then our PURE-Duct Cleaning service. So when you approach us about working with you in partnership to decontaminate your building, this is the important information that we're going to ask of you, or that you're going to need to have ready to be able to have us respond in an expedited manner. So as we look through here, and it's really things that your risk management people, facility management, high-level facility management people should have on hand at all times to be able to address situations that could arise in their building. And of course, this would be, what is the scenario or situation that you're coming to us? Was there a contaminated person or persons in the building that was being used? Are you looking to be proactive? So we're going to have to know why we're being called in as we start to formulate the plan to decontaminate. Of course, this includes what your building use is, how old it is, what are the current conditions of the building, and then we're going to look at total or situational square footage. Was it the entire building, or was it just 1 or 2 offices in a building?
Based on this building, only the plan is going to be formulated and plan of action is going to be implemented. Otherwise, without this information, Troy, we cannot do much.
That's correct. HVAC system schedule, your duct work, and then of course all of the stakeholders that are going to be involved in this project. We're going to need to know all of that up front. So the better prepared you are, the better we are to get started. So with this multi-level approach, we do offer 2 different main levels of PURE-Decon, and the main one we're using to be able to react very quickly and move quickly through your building is our PURE-Decon handheld devices. These are can be used in a proactive, routine way. They're agile and tactical. We can have up to 50 foot of cable running and hose running from the device, so the device can be centrally located. We can move room to room very quickly. We can move around a room very quickly. They are portable electrostatic sprayers, and of course we use a multitude of EPA registered DEPs. Again, that depends on the type of device we're using and the situation that we're being presented with as to which one that we choose. So again, this service really focuses on high touch surfaces, and of course there's no harmful byproducts left behind. Now the other one that we do is PURE-Decon for the indoor environment, and we can use the very similar set of DEPs to mist or spray an entire room for an amount of time. This mist permeates all around the room, and wherever this mist can go, it can kill this virus and other harmful microbes.
That's the important thing here to be understand, that this particular sprayer or mister is going to create a lot of aerosolized particle of the disinfectant, which can, you were asking me earlier, Troy, that it is going to be settle on the different surfaces, and where this kind of thing is hiding, like microscopic or sub-microscopic, living entity, they are going to just take care of that. So that is very good in that aspect.
So one of the most prominent DEPs that we are using within these electrostatic spray devices use hydrogen peroxide and silver. So it's very safe. There's not a lot of residual matter. It just disseminates into water and oxygen when it's done. But what happens is this spray comes out, it attacks the envelope, the cell envelope, and it then binds to the RNA, which halts the replication
of the organism. Yeah,
functions.
Because this basically a hydrogen peroxide give you the nascent oxygen, which is going to penetrate. It's a very penetrative, so it penetrates the cell as it is illustrated in the diagram. And then after penetration, the silver ion is going to bind and go inside deep in the cell, and then they just siege the capacity of multiplication of the organism's nucleic material, which is like RNA in this case, and that's how the organism is going to be killed. So this diagram illustrates that how basically it works.
And that's one type of DEP that we use. We have a series of them that we use in
and most of them having the either hydrogen peroxide, or they're using ammonia based compound. So this kind of thing is, we have taken care of the environmental residual, so the product is not going to left behind a lot of environmental residual product. But you said earlier, Troy, that every scenario is different, so we cannot just have only one and we can apply there. So we need to have some information, which Troy, you have already requested to the participant. If they are very interested in that, they can give you a scenario so that we can.
Oh, absolutely. So when we talk about the air handling units and the air conveyance system, we have two approaches that we use for cleaning those. Very effective, lots of background information on our webpage, case studies, white papers. And so one of them is our Pure Steam HVAC and coil cleaning service. So in not all cases, but if we're going in to thoroughly clean the AHU, we do have a 14-point checklist that we use on this service. We use, well, basically it's eco-friendly, and by that we mean it's steam, it's water. We have a water hookup and it makes steam. So that is Green Clean Institute certified. We do have options for pre and post coil treatment if we need to. Now this steam operates at pretty low pressures, up to 350 PSI, 450 PSI, and then up to 350 degrees Fahrenheit or 176 degrees Celsius at the gun tip.
And that's the thing to be noticed. It's remarkable because 176 degrees Celsius. Well, there are not many organisms going to survive on that, except few bacteria. I don't think that a lot of organisms even can tolerate more than 50-60 degrees Celsius. So this is going to be very ideal. No chemical, no residual. What else you want? Because it's a water, so it is ultimately going to evaporate. So it is not going to be any post effect or any altered effect when people clean or use this product, and afterward they don't have to deal with any kind of the reactive measure that create the thing.
And so we're a very data driven company. We're very focused on M&V testing, job log data, before and after photo data. So with every Pure Steam job and every duct cleaning job for that matter, we offer full reporting.
These are some nice photographs. Why don't you explain some of them, try to our participants?
Well, so many of our risk management people, even some of our facility management people, might not look inside these air handler units, this return and supply ductwork very often. And these are actual photos that we've taken off of the job that shows this kind of fouling on the blower units, on the coils, inside the plenums, and even filters. And filters play a big role in this, not only from catching all the bad stuff, but also the more clogged they get, the more they restrict airflow, static pressure changes, and then the conditions become even more favorable inside of that unit for microbial growth.
And this is the perfect incubation temperature for a lot of microbes. Like, when I use the word microbes, meaning like various kind of bacteria, various kind of fungus, various kind of protozoa, or any other like, organic and inorganic, like, material you can think of. And that might provide a chance to virus flora, like, grow. So we need to seize those stuff.
Absolutely. And then, finally, in combination, we use our PURE-Duct Cleaning service. So, what we do this duct cleaning service at a very, very high level. We've worked in some very prestigious hospitals across the country doing this. And as such, we're working with their risk managers, their ICRA, their personal protocols and safety policies. So we do this under full containment setup protocols. We're making sure nothing's getting into the work area and nothing's getting out of the work area. This prevents cross-contamination as we're taking the dust and debris and fouling out of the ducts, as well as microbes. So we can do particulate monitoring as we're doing this service. Of course, we're mechanically experienced, so we're licensed mechanical contractors. And so as such, we're able to cut access, put access doors in, patch access as we're moving down the ductwork. We're able to also clean terminal boxes and reheat coils and things that are found inline in the ductwork. We are NADCA and ventilation system mold remediation certified. So we're doing this at a high level, and you're getting a full report with any sort of testing data, job log data, and photos. And as such, these are before and after photos from actual job logs. As you can see, this ductwork, this steel and aluminum ductwork can get very dirty, and as well as fiberboard ductwork and ductboard. So this is actual before and after photos. We can come in, clean it, and encapsulate it. And so when we get into our technical approach, and we're wrapping up here, we have 5 different levels that we can come in and do to decontaminate the building. So level 1 is going to be a very basic proactive approach to this. This can be done on a every other day basis, as we're doing it in our own offices here. It can be done every week. And basically, we're going to come around with our PURE-Decon handheld electric sprayer and go through the entire office building and spray all of the high touch surfaces. And again, as you saw on that slide, it's going to be desktops, keyboards, doorknobs, you name it. We're going through the entire office and spraying it. We're spraying up into return grill to the ductwork, and so it's a room-to-room tactical spraying. So we're actually hitting the return grills. Now, when we talk about level 2, we're getting into, hey, we know somebody in this building might have been contaminated, or there's a lot of activity in the building use where students are coming and going all the time, a big building population. So this is going to add level 1, all of that PURE-Decon electrostatic spraying of the entire indoor environment. And what we're going to do is we're going to use another device that is similar to our handheld device that actually we cut access into the ductwork, and we mist the ductwork with the same DEP. And then, of course, we go in with our pure steam coil cleaning process and clean out the entire AHU. And so we're talking the return and supply plenums, the coils, the drain pans, everything inside of that unit gets steamed out. When we move to level 3, we're moving up in the amount of work that we're doing. So it's everything in the previous 2 levels, right? And we're going to do extra topical cleaning, right? We're going to really get into those VAV terminal boxes and reheat coils. And then this topical cleaning consists of HEPA vacuuming all of the carpet, and then spraying or wet wiping all of the surfaces with an EPA registered DEP sanitizer. Level 3 even becomes, or level 4 rather, even becomes more inclusive. So we're providing all of the protocols listed before, and then we provide the most thorough topical cleaning that would also include, wiping the computers down, electronic equipment, any kind of office supplies, merchandise, books, folders, etc. We're going to wipe down pictures, picture frames, posters, artwork, any books and sensitive items will be cleaned inside of a laminar flow chamber.
And that's a very interesting, because when you have the book, this is very intense work that you cannot go through the every pages or every single book, but we do, because we have a technology with the laminar airflow chamber where we can put and we can literally suck out all the contaminant, if you understand in that way, by using that one. And then it's more intense as we are getting in the higher level. Isn't that Troy?
That's true. So by level 5, we're decontaminating everything in the occupied space. And that would include toilets, showers, interior of cabinets and desk drawers, any dishes that would be in a commissary or break room, canned foods on the shelves, the refrigerators, towels, linens, curtains. We're going to do it all if we're talking about a level 5, depending on the use of the building. So as you can see, scientifically based, data-driven, engineered solutions for being able to use not 1, but 3 different processes to decontaminate these buildings. So as we're moving to closure, and we're running a little bit late, a little bit behind, but there's a lot of important information that we had to cover today, and we do thank you all for staying on. But we want to talk about some final considerations or next steps when you're considering building decontamination and the impacts on the building. So first and foremost, since we're in a pandemic now, and we're seeing the federal government defer to the governors of the various states in the United States for how they're going to react to this, we're seeing a lot of coordination here, right? So the GSA has now offered, because we're in a state of emergency, they've now offered their simplified acquisition procedure, or SAP, which allows a city, county, state agency, schools to access our GSA contract for up to $250,000, no bid.
Yeah,
so it's a single source
yes.
Piggyback opportunity because now we're in a state of emergency and the federal government's involved in backing this up. There's also, speaking of the state of emergency and the pandemic that we're in, that as Section 502 of the Stafford Act allows for, and we're already seeing some of our municipal and county government customers invoking this, but through FEMA and Section 502, they're able to get a backed grant to initiate this kind of decontamination protocol, and FEMA will pay up to 75% reimbursement on that grant
and the
directly.
wonderful thing is that, at this time, try not only the United States, but across the world, that the school and other educational institutions, other organizations are closed. So this is the perfect time to execute this plan so that you can just take care of your building hygiene, because this is a downtime. Don't you agree with that?
I totally agree with that. There's a lot of downtime for administrative staff, students, teachers, even in our city and county government agencies. So this is the ideal time to be able to work actively to address this situation, to decontaminate the buildings, and especially for education. We have cooperative purchasing contracts. You can find these on our websites, and we'd like to actually welcome a lot of our cooperative purchasing partners on this webinar. We see you out there, and we thank you for coming. So we're glad you're here. Of course, when you move in to start to talk to us about coming in to work for you, or if you're thinking about decontamination, these next few bullets are really, to get the ball rolling. So, I mean, these are things to think about. Have you had any current COVID-19 related issues with staff or occupants in the building? Someone that has interacted with someone outside of the workspace or the education space, but has come in and continued to work. Even that's being considered now as far as the potential for contamination, right? Are there any plans that you're currently initiating that would be relative to these services we presented? This is something to be thinking about. Are there any other stakeholders in your organization that you would want to have talk to us about this. And this would include if you're a facility manager, maybe your risk management staff, maybe your procurement staff. If you have other prime contractors that do your building management services for you, we would want to know who to talk to in that situation to be able to initiate services. And then finally, if you needed us to come out and actually look at something, although I know that we're in a very regimented social distancing protocol right now, but if you had photographs of the building, the ductwork, the air handlers in question,
work in that way
we
too.
can work in that way too. So
Well,
that
one
being
thing
said,
I want to say, Troy, here that the intent of this webinar was just giving you some information. Based on that, you can take informed decision. So we will be keep continuing that, and in the future we are going to come up with the new findings or anything new development happen in this area. We are going to cover in the next webinar. We are also looking for some feedback if you guys want to know in anything in particular, not only for the controlling the virus, but a total indoor air quality solution to prevent this kind of epidemic and to make our environment safe, workable, productive, etc. Then we will be also able to help you in that way, right, Troy?
That's absolutely correct. We've been at this a long time, since the mid 80s. And so, we're able to help in a variety of ways, obviously not just with the COVID-19. So, that being said, again, Dr. Sahay, I'd like to thank you for being on today with us, and
I
the
guess
many
we
people
have
that joined.
few minutes. We can take people's question, and if you have any question, we can go ahead and take few questions. We don't have a lot of times, but if any one of you have a specific question, this is the time. Just go ahead and type in the box, the question which you have, and we try to answer right away, or we can just find the answer for you. So try you open the platform and see that anybody has any question. If they do, please let me know.
Okay, so Doc, so one of the questions that we had is, should this get in the HVAC system, maybe what is the likelihood of it getting through the return, all the way back to the coil? I mean, these droplets are very small,
yeah,
right?
it's a very, very good and intelligent question, and I want to respond in this way that when we sneeze or cough, then there is a size range of 1 micron to 10 micron in case of healthy individual. In case of sick individual, the size range is 0.05 to 10 micron. So they come in the air. Now, once they come this kind of droplet in the air, then what is the fate of that? Most of them are going to die in the traveling 1 meter or 6 foot, that what everybody is referring. But guess what? Some of them are going to lodge on the surfaces. And if it is on the surfaces, by doing the agglomeration or conglomeration, meaning either the smaller droplets are going to join together to become a bigger spore or the bigger droplets, and then that is going to settle somewhere on some kind of surface. And if the air which is continuously blowing around, that if it is being carried away or by touching or by transferring from mechanical means, like you had some pencil tip or something, you touch it in that way, it can be going there. But at this time, currently, we do not have the data that how long it is going to survive within the ductwork. So that data we don't have.
No, there's no concrete data, but theoretically it's possible for it to be picked up into the airstream and moved.
Yes.
And so, a question that I would have, and just in this discussion is, well, I use very good filters in my air handler units. I use a HEPA filter, or maybe I use a MERV filter, but you're only as good as how many times you change them, or if there's infiltration around the filter bank, right? It could get through there because it's very, very small.
Yeah. Just one more question, please, because I guess we are running out of time. So, or maybe we can respond everybody separately. So we are almost at time. So if time permits, I will take another question, or we can respond to them by email, I believe.
So I see they're asking if there's going to be a handout of this presentation. And so I can answer that. If you would like, you could email myself. My email address is up there, or Dr. Sahay, and we'd be happy to get you a copy of this presentation. Also on our website, if you go to the home page, you'll see a breaking news bar at the top. If you click that, that goes to our coronavirus page. And we do have handouts as well as our position statement on COVID-19 that are right there. You can view them and that you can download them.
So if they request you or me, then yes, we can send a copy of presentation, right?
That's correct. I'm seeing earlier questions. So it says, is anyone else, oh, hold on a second, are immunocompromised people at more risk or just less able to, and then the question cuts off. I mean,
okay, so this is like, I understand what the participant is trying to ask. Like, yes, the immunocompromised, so far the medical, information available that the World Health Organization itself is telling, and CDC also, that the people with the underlying medical condition that include immunocompromised patient, such as like if you have something problem with your heart problem, your breathing problem, you're diabetic, these are the underlying some very common underlying medical condition. So these people are more vulnerable than otherwise.
So a couple other quick questions now that the questions are coming in. So what is the settle time or dwell time that disinfectants must remain on a surface? I mean, I don't think that would vary with the...
This vary with the product, because some of the product is saying that the contact time is as quickly as 60 minutes. The virus is going to kill. Some of them are saying that if we apply those kind of product, that is going to be remain there for safeguarding for some time. So it again is still depend what kind of product you are using. And as we have said earlier, that there is a whole list about 11 pages, Troy, that in the list
is of the disinfectants.
Product. So you have to be careful when you choose those product, and you have to be going through the manufacturer's description on that product. So there is no one answer for every product.
Define M&V testing, that's measurement and verification testing. So before we start to steam clean an evaporator coil, we are going to take readings across the coil to determine what areas of the coil are most fouled. And we're basically looking at this point at linear feet per minute. We can also do more deeper testing on the M&V side by taking static pressure readings pre and post coil while the machine is in operation to get an idea of how fouled or obstructed the unit might be. Measurement and verification testing. What are some examples of the types of businesses that have been decontaminated? So we have worked within very large universities. We've worked within healthcare,
K through 12
schools. We've worked in even small retail spaces,
yes.
Car rental places where people are coming and going and touching surfaces. We do work all over the United States. We have a strong focus in the Southeast, and we do have an office in the Philadelphia area of Pennsylvania in King of Prussia that allows us to mobilize and deploy up into the Mid-Atlantic and the East Coast. We've covered what is the size of the virus, what is the lifespan. Yes, pricing would be based on square footage, size of the unit, and primarily square footage of the HVAC zone. So, when we're looking, let's say you have one floor of a 5-story building that you would want to have decontaminated. We would want to know if your air handler unit is covering all 5 stories. If you have maybe 2 units that are going half and half, we're going to be looking at what part of the ventilation system is, servicing the area where you feel like the contaminated person or persons was working. Of course, we would also be looking at any sort of entrance and egress. So anywhere people come and go from the building, those kind of doorknobs, surfaces, elevator buttons, etc.
Why don't we take all the questions, because we are almost out of time, so we can respond them privately. If you can take 1 or 2 quick questions, that's fine. Otherwise we can I assure all of you that the whoever is asking question will respond them because we are almost out of time here.
Yeah, we thank everybody for staying on this important topic with us for an hour now. So we ran a little bit over, but we feel that the information was important enough. And we do thank you for staying on with us. Again, you can email us, you can contact us via our website, you can give us a call, and we will work through these questions and email responses. I believe we have all of your email addresses. So again, thank you very much.
I thank you every participant. I do know that some of the participants are joining us from overseas. They are pretty late hour over there. So I especially thank you for those participants who are trying to listen this conversation or this good information from overseas. So I especially thank to them, and of course I thank to each and every individual who had participated today's seminar, and we look forward for the feedback to be covered in the next seminar. Thank you all.
Thank you.